Hi, everyone. Welcome to our Caring and Able web series. Today, we're featuring Elevate Oral Care. And I'm going to introduce Hayley and Steve from Elevate Oral Care. Steve Pardue is a managing member of Elevate Oral Care and helped launch the company roughly 10 years ago. He brings 20 years of product development and technical experience focused exclusively on preventive dentistry. Hayley Buckner is a professional relations manager and preventive care supervisor for Elevate Oral Care. Hayley enjoys combining her dental hygiene background and experience to share up-to-date information on SDF prevention. SDF is silver diamide fluoride that we're going to talk about later, patient-centered communication, and cavity risk assessment protocol to dental offices and patients. So I welcome both of you to Caring and Able.
Thank you very much. It's great to be here.
Today, we're going to talk about a lot of different things, but our first question, my first question to you is, who is Elevate Oral Care?
A great question, and thank you very much for having us here today. Elevate Oral Care is a preventive dental company. We specialize in providing products to dental offices and in turn directly to patients many times that really reduce the risk of tooth decay, gingivitis, periodontal disease, and tooth sensitivity. So many of our products are prescription strength, and a lot of our products are actually over-the-counter strength that can be delivered directly to patients. So our focus is when you visit the dentist, you don't always have to have a tooth drilled on. You don't always have to have a state of disease to get a treatment. We want to make sure you can catch those conditions or diseases early, prevent them, or treat them at the early stages before they get seriously damaging to the oral tissues. So that's our company's goal.
Right, and your focus, which is amazing. I've been using Elevate for many, many years, and I am always so impressed with everything that you come out with that's new. And a product that I've been using for years, it's not new, is called Allday Dry Mouth Spray and Gel. And I want to know, why did you come up with this product?
So Allday Dry Mouth Spray it's a great product, and we developed it for a number of different reasons. At our previous companies, we used to own Omni Oral Pharmaceuticals and sold that company to 3M. We managed a line that had a lot of dry mouth products in there as well. There are also a lot of dry mouth products available to patients over the counter, many of which have changed through the years. And those formulations may or may not be as impactful. They may not be as preferred by the patients. So what we wound up doing is creating a product that will alleviate dry mouth very, very well. And it'll also deliver xylitol to the mouth. So it helps prevent other things as well, such as tooth decay. So patients that have dry mouth, they're going to need something to help stop tooth decay because saliva is the body's natural defense to tooth decay. So we figured, why not incorporate something that can reduce tooth decay into the product that's going to help them feel better from their dry mouth symptoms. So that was kind of the beginning of dry mouth. In addition, a lot of our managing members have aging parents. One of our managing members, Rich Crone, his mother has dry mouth. My mother passed away from cancer and through the process had significant dry mouth. So developing these products really kind of touched home for us, making it personal and developing things that can help family members, and we get to see firsthand exactly what it can do. So that's one of the main reasons we developed Allday Dry Mouth Spray.
Right. As a dentist and as a geriatric house call dentist, I always bring Allday spray with me. I don't give it to every patient because if they don't need it, it's a waste. But I can tell you that I've had many patients who've told me that they've had dry mouth over the years, and they show me the product lines that they've used. And I'm not going to name them, but I always say, no, that doesn't last very long, or that's not exactly going to help you for many different reasons. And I provide them with the Allday spray. I always give them the first one because I feel like if you don't actually provide your patient with the first sample, they forget to order it. But the minute I give them the Allday spray, the full bottle, they literally tell me how much they love it. And my favorite story, one of my favorite stories, is about a woman who tried every product. She literally had a basket of dry mouth products. It was upsetting. And I gave her the Allday spray. And this is So funny. And she called me the next day and she's like, I love this. I put 2 or 3 squirts in. It lasts for a few hours, but I have a question to ask you. And I said, what's the question? She goes, how often can I use it? And I say, guess what it's called? And we just had a big laugh because I mean, I think it's the most brilliant name because you can use it literally all day. And even for me, I don't really have a dry mouth problem, but I know before I go and do these recordings, I always give myself 2 sprays and it lasts at least an hour. And at night before I go to bed, I spray it in my mouth. So I think it's a product that's useful for everyone, not even even if you don't even have a real issue. I think it's just something that keeps your mouth moisturized, which feels good. Um, who should be using all day spray? I mean, I use it, can anyone use it or who should be using it?
Hayley, I'll let you answer these.
Sure. Like you said, Dr. Kauffman, all-day dry mouth spray can really be used for a number of different patients. Certainly those patients that are suffering from dry mouth and have complained to their provider about dry mouth. And that can come from a lot of different things, whether you're on a lot of different medications that may make you at a higher risk for dry mouth, or if you have certain different syndromes and diseases that can put you at risk for having a dry mouth as well. So any patient that is suffering from dry mouth would be a great candidate to use an all-day dry mouth spray. But also, even like you said yourself, if you're out there speaking, if you notice every once in a while you experience some dry mouth yourself, not from a true issue, but just a little bit of dry mouth yourself, you can absolutely use it. So it provides relief to anybody that is suffering from those dry mouth symptoms.
People often ask me, can I use it with my other oral care products, which I want you guys to answer, but I want to tell you, this is not Elevate saying this. This is not a statement from Elevate. This is a statement from Dr. Alisa Kauffman. I have found a very useful way to use it with my patients who swallow toothpaste. Because of the thickness of it and it's gel-like, I will often recommend it to my patients that have dementia or other cognitive issues, or patients that cannot swish and spit for whatever reason, to use it on the toothbrush and to use it as toothpaste. So I know that that's kind of out of the box, but I'm saying that from my personal point of view as a dentist, that I tell my patients who cannot use traditional toothpaste to use this, because this is a lot better than using nothing. And I really appreciate that I'm able to give them something to use rather than nothing. But along with that, can you use all-day spray with traditional oral care products?
Yeah, absolutely. It can be used with all sorts of different over-the-counter and prescription products. So a patient can certainly still brush with their over-the-counter toothpaste or their prescription fluoride toothpaste. They can still be doing any kind of in between the teeth cleaning with flossing and still absolutely use this as an additional therapy, because this will actually target the dry mouth symptoms, which a lot of those toothpaste and other cleaning products don't target specifically. This one's going to help treat the dry mouth symptoms. So it can absolutely be used with all sorts of different oral care products that the patient is using.
So for people that are interested and are listening to this, where can they purchase it? And do they need a prescription?
That's the neat thing about Allday. It's an over-the-counter product. So they can purchase it directly from their dental office if their dental office happens to have the product available for them to purchase. It can also be purchased directly from elevateoralcare.com and then also through Amazon as well.
Yeah, Amazon's a big one. People just love to just go on Amazon and just purchase it quickly. How does it actually work for people that are interested in why this is better than the other products out there?
I thought you were saying that, Steve. Sorry.
I can take that if you like. So all-day dry mouth spray works a little bit different than many products that are on the market. One of the main ways it works is there's water and xylitol, and the xylitol is dissolved in the water, and there's a mucoadhesive in there that creates these small bubbles of water containing xylitol. And the mucoadhesives actually stick to the inside of the mouth and gradually release the xylitol through time. So think of it as a time release mechanism to deliver xylitol that prevents or reduces tooth decay in the mouth for up to 3 hours over quite a long period of time. So not only does it deliver the moisture from the water, it also delivers the xylitol to help reduce tooth decay risks. So kind of a unique delivery in the dry mouth product world.
The way I explain xylitol to my patients, and I want you guys to correct me if I'm wrong, but it's a naturally occurring sugar found in fruit and vegetables. So when people say to me, oh, I don't want to use xylitol, I always tell them it's not saccharin, it's not a fake sugar, it's a real sugar. Can you guys talk about that a little bit more?
Absolutely. In fact, xylitol is something you pretty much can't get away from. It occurs naturally in corns and berries and pretty much any vegetable. So it's produced naturally. You can't be allergic to it. It's actually produced and used in the liver in the body every day. So it's not something to be afraid of. It's something that's part of our own metabolism.
And finally, is dry mouth a really prevalent issue, or is it just a nuisance that like a few people have?
It's a very prevalent issue, and it's becoming more prevalent as our population ages and as our population takes numerous different types of medications. I think there's a list of about 800 known medications that can have dry mouth as a side effect to some varying degree, but that's very much very common in the world today. So yes, it's a common and growing problem.
Is there any other therapeutic benefits of Allday gel and spray?
The therapeutic benefits are really the delivery of xylitol to help reduce tooth decay, and then also the coating of the mouth and relief of dry mouth symptoms. Those are two of the main benefits that you can expect from the product.
Right. And just for people who are listening, you just squirt it in your mouth and your saliva carries it and covers all of your teeth, which I tell my patients is a great benefit. You don't have to think about it. You just spray it in your mouth and just let whatever little saliva and your tongue do the work. Do you want to have anything more to say about that? Is that accurate?
Essentially, that is accurate. The best way to use the product is spray a few squirts on your tongue and then rub your tongue across the surface of your teeth, and that will coat all the surfaces and stay there as long as the product possibly can. So that's the best way to deliver it.
And I can tell you that it tastes delicious and no one complains about it. And it has the right viscosity. It's not goopy, it's just perfect. So I definitely recommend it to all of my patients. And I really appreciate Elevate for finding a solution to dry mouth that makes sense and really helps a lot of my patients. So I thank you for that.
Thank you. Very good.